Hello there, it's Sunday, and it seems that from tomorrow, the lockdown as we have known it is more or less coming to an almost complete end. I mean, from tomorrow, interstate movement, of course, is already happening. People have been going to office. A lot of activity has resumed already. And even some of the areas which were blocked till now or stopped till now, such as going to religious places, going to malls, going to shopping centers, restaurants, a lot of that is going to be permitted from tomorrow, including in some of the worst affected cities such as Delhi. And that is somewhat puzzling because these are cities where coronavirus cases are rising very fast, 1,200, 1,300 cases a day, perhaps more cases than that would be coming out if everyone was actually being tested, which is not happening. Hospital beds may soon be coming under a certain amount of pressure. But despite that, governments everywhere seem to have decided that let's open up as much as we can. And from tomorrow, even though Delhi's borders with other states are going to be thrown open. But while we're on the subject of Delhi, and it's perhaps correct to focus on the city a lot right now, seems to be the biggest hotspot or the biggest growing hotspot. A decision was taken by the Delhi government today that hospitals run by the Delhi government will actually be reserved for residents to prevent a flood of people coming in from outside to fill up those beds. And that obviously is going to lead to a certain amount of debate as well. And all of this opening up and coronavirus happening even as India and China are continuing to face off on the line of actual control, although some statements have come saying that they will try and resolve this matter in a peaceful manner. All right, let's show you all the big stories this Sunday evening.
India on Sunday reported the highest single-day spike of 9,971 new COVID-19 cases and 287 deaths in the last 24 hours, taking the total number of cases in the country to 2.46 lakh. The figures include 1.2 lakh active cases and 6,929 deaths. India's top four metros, Delhi, Mumbai, Kolkata and Chennai, account for nearly half of the nationwide COVID-19 tally. These cities also have a similar share in the death toll, which is nearing the 7,000 mark. Along with metros, the three other major urban clusters badly hit by the COVID-19 pandemic are Ahmedabad, Indore and Pune. These seven cities together account for 60% of overall confirmed cases and more than 80% of the deaths across India.
Addressing the media, Delhi Chief Minister Arvind Kejriwal said some beds in private central government-run hospitals will also be reserved for Delhi residents as the national capital witnessed a sudden surge in the number of COVID-19 cases. He added that all restaurants, malls and places of worship to open in the national capital from Monday, but due to rising cases, hotels and banquets will not be open for now. He said relaxation does not mean that the fight against COVID-19 is over. Citizens have to remain vigilant and continue to wear masks. Kejriwal made a special request to senior citizens saying that the lockdown is more important for them and they should keep their social interactions to a minimum since the deaths among the elderly are the highest.
There will be 1 lakh cases of COVID-19 in Delhi by the end of June. Members of an expert committee set up to aid the government in planning the augmenting of health infrastructure in the city-state said on Saturday. The 5-member committee tabled its report to the Delhi government on Saturday and the government is yet to make its findings public. However, reports quoting a committee member said Delhi will need 15,000 beds by the end of the month and around 42,000 by mid-July.
The Delhi Medical Association has condemned the FIR against Sir Ganga Ram Hospital. The body in a press release stated that Delhi Chief Minister Arvind Kejriwal's warning to doctors and threatening hospitals for the admission and testing of COVID-19 patients is condemnable. The statement said that doctors who have been risking their lives amid the pandemic to save lives feel insulted by the way they are being treated. The DMA said the move was demoralising for the whole medical fraternity, adding that Ganga Ram Hospital and its doctors have saved lakhs of lives in the past decades and are being penalised and threatened.
Liquor in Delhi will be cheaper from June 1st as the AAP government on Sunday decided to withdraw 70% special corona fee on their sale in the national capital. The government, however, increased the value-added tax on all categories of liquor from 20% to 25%. The decision was taken at a cabinet meeting chaired by Chief Minister Arvind Kejriwal. The special corona fee was imposed last month on the maximum retail price of liquor bottle as the government looked to earn additional revenue hit badly due to the coronavirus lockdown.
Shopping malls and places of worship will not reopen for the public in Gurugram and Faridabad districts which have been worst hit by COVID-19 in the state. Malls and religious places will be open in other parts of Haryana from June 8th, the state government has said. Of the more than 3,800 coronavirus cases in Haryana, Gurugram alone accounts for over 1,600 and Faridabad close to 600. The Union Health Ministry on Thursday released SOPs for reopening offices, hotels, shopping malls, restaurants and religious places as part of efforts to restart business activities to contain the economic fallout of the pandemic.
A day after Indian and Chinese army commanders held a meeting to resolve the tense situation along the line of actual control in eastern Ladakh, the Ministry of External Affairs on Sunday said that both sides have agreed to resolve the border issues in accordance with various bilateral agreements. The statement from the government further noted that peace and tranquility in the India-China border regions are essential for the overall development of bilateral ties. It said the meeting was held in a positive atmosphere on Saturday and hinted that it could be first in a series of meetings, saying that dialogue will continue at both military and diplomatic levels. The statement added that the two sides will continue military and diplomatic engagements to ensure peace and tranquility in the border areas.
Brazil removed months of data on its COVID-19 epidemic on Saturday from public view as President Jair Bolsonaro defended delays and changes to official record keeping. Brazil's health ministry removed the data from a website that had documented the epidemic over time and by state and municipality. The ministry also stopped giving a total count of confirmed cases. Bolsonaro on Twitter said that the cumulative data does not reflect the movement the country is in, and other efforts are underway to improve the reporting of cases. Brazil has the world's second largest coronavirus outbreak. Cases have shot past 6.7 lakh. Brazil's death toll passed Italy this week, nearing 36,000.
In a big shift from its earlier position, the World Health Organization has issued new guidelines that say everyone should wear a 3-layer fabric or non-medical mask in public to prevent the spread of COVID-19. People above 60 years or with health issues should wear a medical mask in settings where social distancing is difficult, and all others should wear a 3-layer fabric mask that acts as a barrier for potentially infectious droplets, according to the new guidelines.